Namaskar, good morning. Myself, Dr. VIPUL Gurjar. I am the head and the professor of the Department of Surgery in SBK's Medical College, Vadodara, as well as I am practicing surgeon in Vadodara. Today, I am going to extend our laser topic discussion. Last time we discussed about the basic principle of the laser. Now I am going to talk about the purchase and basic how to operate the laser machine itself. And in next video, I will definitely give the practical vision of this machine operating system. Okay. Once you have, if you have decided to purchase the laser machine, now which machine is important? Then for that we are discussing. In market, two three type of machines are available. One is a smaller machine, which is the watt machine is approximately 10 to 12 watt machine. Second, the machine is most common available is the 15 watt machine, and one laser machine is going to promote a 20 watt machine in a future also. Now, what is 10 to 12 watt machine available? According to me, 10 to 12 watt machine is not meant for the anorectal surgeon, because in a anorectal surgery we need to keep this machine at 12 to 15 watt for the fistula and pilonidal sinus surgery, as well as excision process we need a somewhat higher watt machine. Okay, so if it is smaller one machine, I don't think it is used for as an anorectal surgeon, but you can use as for the dental surgery, that because it's a smaller one, and some small excision surgery, or the you can use for the vascular surgery. That's your choice. But as an anorectal, I would recommend the 1470 diode machine. Okay. Now, second thing, the now there are the different type of machine is available. One is 650, 980, 1470. Okay. Initially, it was available with the 980 for the endovascular, but for 1470, after the coming of 1470, it is 60 times more potent than the 980 for the anorectal surgery. And nowadays, dual mode machine is also available. That means in a machine itself, 1470 mode B is there, and second is the another option, either 640 or the 980 or whatever you want, it can be added. So dual mode machine is available. My preference, if you are doing the anorectal surgery and you are getting not doing the endovascular surgery, then prefer the 640 or 650 with the 1470, because in diabetic foot and infection control, as well as for the healing ulcer, 640 machine is mode is important. So my recommendation is 1470 dual mode is for you. Okay, the person who has their own 980 old purchase, then what to do? Then if you are doing anorectal surgery more, then I recommend it definitely to upgrade the machine. It is possible, and the cost is not that much costlier, so definitely you should do, because you will get definitely a much more benefit for the anorectal surgery. So my recommendation is to upgrade up to the 1470. Okay, and now the companies, I don't want to go with the companies in detail, but the company who is remain in with you in your progress, definitely you should buy according to your requirement. Okay. Okay, after this buying of this machine, how it looks, it is normally, it is now the touch screen is available. It should be a compact one. It is like a 10 by 1 foot by half feet machine is there. On screen there is a watt machine is available. What is a watt of machine? That means you can put a machine at a 1 watt, 2 watt, 3 watt, 4 watt, 5 watt, 6 watt, and up to the 15 watt machine. That means machines, the strength at which the energy is delivered is a watt machine. For a piles, we can do the 7 watt machine. You have to keep for the pile surgery. For the fistula or the pyloneural sinus, you can vary up to 10 to 15 watt machine. And if you are using for the some infective procedure, then you should go down, that means a 1 watt machine. Okay, so now as per example, if you are doing pie surgery, am I right? Okay, now how to operate? First, there will be a key behind the machine. After then, you can switch on the machine itself. Okay, so there will be a power. Then second, there will be a key in many laser machine, not everywhere, but many laser machines. You have to apply that key. Then and then machine will be work. Okay, and there is a attachment of fiber. This attachment may be the side one or the from the back. After this attachment of fiber, then and then muscle may work. This facility is given for many laser machine. So sometimes if you are operating and you have started the machine, you have not kept the laser fiber inside, the machine may give the warning tone, that means you have not inserted the fiber inside. There will be a switch or red color switch is available over the all the laser machine. This is for the emergency stoppage of the laser machine. If you have any problem, you just open the machine and or press, so machine will stand by over at that moment. Okay, now another attachment is the foot pedal. There are the two type of foot pedal available. One is the wireless and second is the wired foot pedal. Normally both the facilities are available with the most of company now onwards. I prefer the wireless machine because we have to move here and there according to we need. So wireless foot pedal is a good option. Once you open the switch on the foot pedal, it will be directly attached as a Wi-Fi of the laser machine. So there will be a indication like our Bluetooth. It is attached and it will blink a green light. Okay. So after this arrangement, you can start our surgery. Okay. Now if you want to, like as per example, I am giving two example, three example how to operate per case. As for example, now you are going to operate a third degree piles. So how to start the screen? After this opening of the screen, there is a pre settled criteria is available. That means if you go in a menu and you will see the surgery, gynecological, dental procedure or other procedure also, then you go with the surgery. Then you can get definitely some menu like a fissure surgery, grade 2 piles, grade 3 piles, grade 4 piles and elsewhere. If you are going likely click with the grade 3, the machine directly put itself on a pre-recorded criteria. That means it may show the 7 watt machine, pulsatile mode and duration also. Okay, but I recommended it should be according to your need. Do not try initially, or you can try initially, later on you decide your own experience on the laser machines. Now as for example, I am doing with the laser machine which I don't have a dual mode. Okay, I don't have a dual mode. Then what to do? I start the screen, then I put a machine on the 6 watt. Okay, 6 watt machine. Then I will, if I have a conical fiber, then I will put machine on the pulsatile mode. There will be a click of a pulse mode or repeat mode. I will click that. Then second, there will be a second option. I will put the machine at the 20 second and that's it. So what happens? The 6-watt machine, if I'll start with the pulsatile mode for the 20 second, then it might, according to my knowledge, it might deliver 96 joule. Okay, so I'll, that is a 20 second. This is specified. Put at the 20 second. Okay, because the per mile pile mass we need approximately energy of around about 200. Around about the 200. Okay, so I'll, then there will be a standby option and you click that standby, so it will be a green one, so it will starting machine. Okay, that means you are ready for the surgery. Then take a fiber and pull, go inside the tissue and start with the foot pedal. If you press the foot pedal, the energy will start to emit. After the 20 seconds, the machine will stop because you have arranged the 20 second. That means you have given the 96 joule this time. Now if you feel that you require more, then you just put on the foot from the pedal and further start. It will give further cycle of 96 joule energy in 20 second. If you want to go the 30, is depend upon you, you save. I recommend that you should not give the continuous energy because sometimes it may damage the 96. After the 20 second you judge all this what you have done and further you apply the energy. That's why I recommended to 20 second. Now sometimes if the peoples are using the continuous watt, okay, that means 6-watt machine, then you click a continuous watt and you put a 20 second. This is same? No, it won't be same. Now you see in the screen that total energy consumption will be at approximately 126 joule. So by clicking the pulsatile mode and the continuous mode, the energy will be changed. So if you want to give that, you should change the second. That means you keep the second 16 watt approximately. Then and then with the one cycle with the continuous mode at the 6-watt machine, you will deliver approximately 100 joule energy. So the clicking of continuous mode and the pulsatile mode, it may differ the joule energy. Okay. So you, there will be a many questions that what is a pulsatile mode, what is a continuous one, what is the ideal one. There will be some more different lectures on that. You can go through that only. But my recommendation, if you have a conical fiber, go with the pulsatile mode. If you have a bare fiber, you can go with the pulsatile mode, but with the using of some movement of your hand. If you are doing it with the continuous mode, there is a more chances of burn, so it is better to use a conical fiber and the pulsatile mode for the pile mass. For fistula pyloradial, definitely a radial fiber and a continuous only. If you want to cut the skin or skin tag, I recommended you the machine should be on 10 to 12 watt and on the continuous mode. But my recommendation is to arrange a 20 second, or you break up the total energy, in a 2 part or the 3 part, so you will get a more the time to observe your result and you will not harm too much. Okay, So this is about how to operate the machine after the buying of a laser machine. If I have a dual mode, like I have a dual mode, so I am using this machine on the dual mode option only. If I click the dual mode, there will be a 1470 plus 650. I will click that. There will be a two option. That means the machine is the 6 watt, and there will be a arrangement of dual mode. That means 1 watt from the 650. These companies are recommending this dual mode is more important for the infection control and more efficacy about the regression. There is a no long term my experience about this result, but there is a no harm. We should definitely accept this company's belief, and because there is a no harm, that's why. And I am using nowadays only the dual mode for the piles as well as fistula surgery. Okay. Okay. Now, if you want to, what is the use of 640 machine? There will be a 640 machine is mainly used for the healing purpose, hair growth, for ulcer healing, for infection control, trophic ulcer. This is known as a low laser therapy machine. Okay. The 640 machine is, there is a separate click over that, and there will be a separate probe is also available, and in that probe we have to attach the bare fiber only. There is a separate lectures on the diabetic foot with the laser machine. You can go through that only. And now for the other thing, if you have a query, please let me give your queries in a description box, so we can solve according to need. So in our next lecture, I'm going to give the practical appearance of laser machines, how to operate. So this is for the how to purchase, what to purchase, and how to start the laser machine itself. Okay. The fiber handpiece, there will be a separate lecture. This is only for this two topic only. Thank you very much. Thank you.